Hello and welcome to the discussion on diabetes and cardiovascular disease. I am Richa Jain Kalra. As we all know, the relationship between diabetes and heart disease is quite complex. Diabetes affects blood glucose or sugar levels, but it also profoundly affects our other body systems, including the cardiovascular system. Did you know that more than 65% of people with diabetes die from some form of heart disease or stroke? So, today I have a very experienced and renowned panel of doctors with me to discuss this subject. I have with me Dr. Susanta Pradhan, HOD and Senior Consultant, Interventional Cardiology, Utkal Hospital, Bhubaneswar. Dr. Abhishek Kasha, Interventional Cardiologist at Aster Naranadri Hospital, Tirupati. Dr. Devendra Kumar Shrimali, Director, Department of Cardiology at the Narayana Multispeciality Hospital, Jaipur. So I want to start with Dr. Devendra first. Dr. Devendra, recently this month we celebrated the World Diabetes Day. In your opinion, what is the importance of this day, especially in the Indian context?
Hi friends. First of all, I would like to thank Times of India and Merrill company that has given an opportunity to discuss about this important topic. We know that the World Diabetic Day it is celebrated on 14th November on each year, and it was established by the Indian Diabetic Federation, and World Health Organization to raise the global awareness about the diabetes. We know that why it is important. It is because that the global burden is increasing day by day. We know that the population wise the diabetic numbers are highest in the China, and we Indians are having the second largest population of diabetic patients. We are number one in hypertension. We are number one in heart attack, also coronary artery disease. So this day becomes important because if we detect early diabetic, we can save so many lives. It is linked to so many serious problems, like we know that it is related with the heart attack, stroke, diabetic retinopathy, gastropathy, autonomic neuropathy, nephropathy means it affects the kidneys also, and it is one of the important causes of amputation of lower limbs. So it is really important, particularly in the context of Indian patients, because sooner or later we are this is projected that we are likely to become number one in diabetic also.
I want to now come to Dr. Susanta Pradhan. Doctor, to begin with, how would you explain diabetes, which is rising so rapidly, in simple clinical terms?
Actually, diabetes is rapidly increasing. Approximately 10% of the world population suffer from diabetes. And diabetes is mainly related to the insulin, either insufficient insulin secretion, or if its insulin is production is normal also, there is insulin resistance. But because of insulin mediated actions are not occur in body. So that ultimately leads to the hyperglycemia, means blood sugar level is high. And if blood sugar level high in the chronic phase leads to the damage to the heart, brain, kidney, blood vessels, and eye. So all complications occur if long-term diabetes occurs. So we have, if patient is diabetes, go for regular checkup, immediately control the blood sugar is most important thing.
Dr. Abhishek, why is it that diabetes is becoming so common in India? What are the factors leading to its rise so quickly?
Yeah, Richa, actually, over last few decades, our lifestyle has changed dramatically. People are eating more calorie-dense foods, we are exercising less, sitting for longer hours, dealing with more stress. All of this leads to our weight gain and insulin resistance. So we Indians has one of the highest genetic predisposition to diabetes in the world, which means even a small lifestyle change can trigger the disease in our Asian and Indian population. That's the reason why diabetes is increasing in India, because we have the combination of lifestyle, gene, as well as the environment factor. Adding to this, urbanization, rising obesity, irregular sleep patterns, and high stress levels are contributing.
Dr. Devendra, is it true that diabetes is one of the very big risk factors for a heart disease?
Yeah, because diabetes actually it affects and it damages the vessel lining, and when this vessel lining, which we say that it is endothelium, So when it damages it, the allows the cholesterol, blood cholesterol, to be deposited in the vessel wall. And what happens when it is deposited in the vessel wall? There is development of blockades. So when it blocks and it increases the plaque burden, means development of the cholesterol deposit within the vessel lining. It decreases the blood flow through the vessels. More important is that in the diabetic patients, the disease is more diffuse. It affects means entire circulation. It is more calcified and it is more unstable. Unstable means, like, even in many of the patients, 30 to 40% blocks can cause heart attack by plaque rupture. So it is important in that way also. More important is that it is known as silent killer. We don't know actually. Sometimes it damages the nerves, and we don't have the symptoms of heart attack also. So it is a silent killer also. Then, along with the diabetes, there are certain other diseases which are more often associated. It is not a coincidence actually. It is actually associations, like blood pressure, high BP or hypertension is more closely related with the diabetes, high cholesterol level, obesity, and inflammation means within the vessel wall there is more inflammation, and which again causes more chances of plaque rupture and acute heart attack. In my opinion and in my personal experience also, many of the young patients, two important factors are important in young patients heart attack. One is diabetes, second one is the smoking. So because we know that this diabetes increases the heart attack chances approximately 2 to 4 times as compared to the like same group of other persons, those who are not having the diabetes. So just like having the diabetes increases your chances of developing the heart attack, strokes, and other problems. So that's why it is important that we should treat it aggressively.
Dr. Pradhan, what makes heart diseases in diabetics different from those in non-diabetics?
Yes, diabetes is producing myriad of symptoms in heart. Like first, it produce the coronary disease, like heart attack. Second, along with the heart attack, produce the heart failure, means heart pumping function is decreased, leads to the heart failure. There is increased chance of the irregular heartbeat, like atrial fibrillation, and also peripheral vascular disease, like leg amputation will occur. So these are the symptoms due to the diabetes. And diabetes produces the not typical, if patient having heart attack due to diabetes, usually not typical produce symptoms of chest pain. They are producing the symptoms of dyspnea or lightheadedness, fatigability, and dizziness of head. These are the atypical symptoms. And sometimes patient without any symptoms, patient suddenly collapse, like silent attacks will occur. And along with the diabetes will not produce symptoms immediately. It will lead to the chronic phase. These are the complications occurs. And second thing, that diabetes not comes is isolatedly. Usually it comes with the increase of blood pressure, like hypertension, high cholesterol, dyslipidemia, obesity, and all other symptoms. Means, the risk factors are producing the myriad of symptoms producing the heart attack. So if patient is heart means, diabetes, these are the symptoms can produce, and heart attacks can produce silent attacks, not typical symptoms produced due to the diabetes patients. And if diabetes occurs and coronary disease, these lesions are like diffuse coronary disease and multivessel disease, and vessels usually small. And the treatment also is difficult, because if as a diffuse vessel disease, multivessel disease, treatment also is difficult, because we cannot treat the lesions all simultaneously. We cannot put the stents, all things. So, and if there is put the stent also, there is high chance of the restenosis, and repeat procedure also required. So these are the highlighting features of diabetes having coronary disease.
Dr. Abhishek, there's this trend that some heart attacks in diabetic patients go unnoticed. Why is that so?
Yeah, it's in simple words, diabetes can mute the pain of heart attack, making it unrecognized and making it more difficult for a layman or a patient himself. The reason behind this is when the nerves become less sensitive with the ongoing diabetes, the classic warning signs of heart attack like severe chest pain may not be felt. Instead, diabetic patients may experience very subtle and non-specific symptoms like unusual fatigue, mild breathlessness, sweating, indigestion or discomfort, and few can experience a jaw pain, back pain, or shoulder pain, or feeling lightheaded. Because these symptoms doesn't look like a typical heart attack, many patients ignore them, they stay at home and seek the medical attention when symptoms become more and more worse.
Dr. Devendra, what kind of lifestyle measures would you suggest for diabetics to protect their heart health?
So first of all, we start from the lifestyle. Lifestyle in that actually diet and exercise. These are two important lifestyle changes which we should adopt. In the exercise, almost 30 to 40 minutes every day we should exercise, and along with the 2 to 3 times a week, like strenuous exercise can be done. Then this can include any type of exercise, particularly the aerobic exercise, which includes like walking, jumping, swimming. All these are very important in exercise. Then in diet, we should try to avoid the fast food, junk food, and we should try to adopt high fiber food, lean protein, healthy fats like nuts, olive oil, seeds. We should try to reduce sugar and refined carbohydrate from our diet, and we should control portion sizes also. We should try to avoid deep fried foods and excessive salt also. So because all these dietary habits can increase the chances of developing plaque and ultimately heart attacks.
Dr. Susant, can heart disease in diabetic patients be actually prevented?
Yes, definitely. Because diabetes is a disease which can produce the coronary disease. It usually can be prevented if timely diagnosed. Early diagnosis and treatment is mandatory, and it can be preventable. And for that, you require the lifestyle modification along with the blood sugar control. And lifestyle modification like regular exercise and healthy food like low fats, low cholesterol diet, and low in salt and high in fruits, vegetables, legumes. Along with the regular exercise is required, and stressful life is most important because most of the people having stress along with the diabetes, because patient has diabetes along with stress means that produce the symptoms, produce the more aggravated symptoms. So diabetes having coronary disease can be preventable if you treat immediately and diagnose immediately and take care of these symptoms.
I want to draw in Dr. Abhishek now. How often do you suggest, doctor, that a diabetic patient should get their heart checked?
Well, Richa, so it's a good question. So diabetic patients should undergo regular and structured heart evaluation because they are at higher risk of silent and progressive heart disease. The frequency depends upon the symptom as well as the risk profile, but there are clear general recommendations. Cardiac screening I recommend for all the diabetic patients who have a controlled diabetic profile. The minimal requirements include the blood pressure checkups, ECG, a treadmill, that is a stress testing, cholesterol and lipid levels, whether they are in control or not, a thyroid, kidney function tested regularly. If patient's diabetic profile is very bad, very poorly controlled, and these patients also have a strong family history of coronary artery disease, as well as if they are symptomatic, they must seek the cardiac attention. They must meet the nearest cardiologist, get evaluated either with CT coronary angiogram or a conventional angiogram to rule out the underlying coronary artery disease. As well as they must undergo 6 months checkup for the diabetic profile as well as close monitoring of their lipid profile.
Dr. Devendra, are long lesions in diabetes better treated with long stents, in your opinion?
Yeah, definitely. But if we treat such lesions, then we should try to avoid multiple stenting at the same time. We should try to use the long stent in a single way rather than putting 2 or 3 stents in a multiple way. Because if you put 2 or more stents, so when they are actually adjoining at particular site, the chances of inflammation and developing restenosis are higher at that particular site. So in such condition, long if there is a long lesion, try to cover it with the single stent. So if you have a better quality of a stent which can cover and which can negotiate through the lesion, then that could be a better option for treating long lesions.
Dr. Pradhan, where do you see the use of drug-coated balloons in the treatment of diabetic patients today?
Yes, the use of drug-coated balloon is rapidly increasing nowadays, and there is the guidelines also. There is broader guidelines as recommended for the use of drug-coated balloon. What mechanism of action drug-coated balloon is? The balloon drug is over the surface of the balloon. If you go on coronary artery and inflate the balloon there, the drug in the periphery of the balloon, it is absorbed into the intima of the vessel. And if you inflate up to, usually we are inflating 1 to 3 minutes, and during that period the drug is absorbed to the intima, and after that balloon is removed, and these drugs remain in the vessel wall for 1 to 3 months, and during that period there is inflammation chances low, and there is no metal behind that, and that is the important of drug coated balloon. Why it is important in diabetic patient? Because diabetic patient having small vessel disease. In small vessel, we cannot put the stents all over the all coronary arteries. And drug coated balloon is beneficial in that case because we not leaving any metal behind that. Second thing, that diabetes patient having multivessel disease, and we cannot put the stents all over the, if you small vessel, multivessel disease and diffuse disease, we can treat this patient with the drug coated balloon, and there is high chance of restenosis with put the stent. And if you put the drug coated balloon, the chance of restenosis is low. And even if the restenosis occur, treatment will be better. So diabetic patient better treatment with the drug-coated balloon in present. And the most of the guidelines also now recommended that if patient is a diabetes, diffuse disease, and small vessel disease, it can be better treated with the drug-coated balloon.
We've touched upon the DCBs or the drug-coated balloons. Dr. Abhishek, what are the key advantages that you see of DCBs in small vessel disease?
So, drug-coated balloons is a modern technology and modern boon to the intervention cardiologists currently. So, DCBs, though the literature of use is bit less, but it is blooming, and we get majority of the medical companies coming with sirolimus coated drug-coated balloons as well as paclitaxel coated drug-coated balloons. They do a wonderful job, but coming to drug-coated balloons per se, in bifurcation lesions, in small vessels, in calcium where you cannot stent the artery, and in diffuse disease, still they have a good say, and I vote for a drug-coated balloon in such anatomy.
Now let's talk about bioresorbable scaffolds. Where do you put these in treatment for diabetic patients with coronary artery disease?
So, Richa, this is bio-reabsorbable scaffolds. We call it as, but later on, we are coming up with a newer technology where magnesium is added to the scaffold, making it more human friendly. So, these are not the go for all the patients, but a wisely chosen, selectively chosen patients. These can offer a long-term therapy because the whatever we talk about the drug-eluting stents where the metallic scaffold will stay with the patient forever, whereas in bioreabsorbable scaffolds, the whatever the material we place within the blood vessel would get reabsorbed within 2 to 3 years of time. Few questions are selecting the patient and selecting the vessel are important. These are not for complex disease as well as these are not for the disease with long segment lesions. They are not ideal for calcium. They are not ideal in case of acute heart attacks. So we must choose a bigger vessel, and younger patients with simple type A and type B lesions we classify in as per cardiology terms. These patients may benefit from bioreabsorbable scaffolds. To make it simple, bioreabsorbable scaffolds are not the only therapy for everyone. They are not a safest alternative. For a selected patients, yes, they are a safest alternative, but this is not for all. Still, lot of data is required and stronger evidence we need to produce.
Dr. Devendra, what improvements have you seen in the newer generation of the BRS devices now?
So we know that the previously BRS was introduced, but ultimately what happened because of the thickness and other important parameters, which actually in trial also they failed to give superior results as compared to the metal stents. But now with the so many other companies, particularly in India, we have a pride that the Marel has introduced one of the finest BRS, which is having thickness of approximately 100 micron. Previously, the other companies which used 150 micron thickness of stent. So this Merrill has introduced 150 micron stent size, strut thickness that has increased the chances of inflammation less than because we know that over a period of 2 to 3 years, this stent is reabsorbed completely from the circulation. So the chances of developing restenosis with the metal stents are actually not there. Then it is having very good strength also, and the trackability is also very good. That's why it is, I think it is being used more and more now in particularly diffuse disease, particularly in a patient where who is having like higher disease tendency in future also. So in such condition, if we use this BRS, so most important thing with the BRS is that if we use this in a person who is having diffuse disease, and the chances of like in future patient can develop restenosis, and the chances of developing requiring bypass surgery is high, then this stent is completely absorbed from the circulation of the
Right.
vessel wall. So the in the future, same patient with the BRS can go for bypass surgery also if it is needed. So that is the beauty of this stent, that it is completely absorbed from the circulation.
Dr. Pradhan, after an angioplasty is done, what should diabetic patients keep in mind in general?
Angioplasty only is the procedure, and post-procedure care is as important as angioplasty. Because if you don't take care of the post-procedure care, it leads to the restenosis chance, stent thrombosis, and also diabetes-related complications. So first and most important is the control of blood sugar is most important, and target of glycosylated hemoglobin is HbA1c you are taking care, means that like target is should be less than 6.5. The second thing that take regular medications regularly. As per doctor advice, you should take the dual antiplatelet therapy, which is taking the aspirin or other antiplatelet drugs, which are termed as blood thinners. Along with have to take the antihypertensive medications if patient's blood pressure is high. Antihypertensive medications should be taken regularly according to the doctor advice. And most important thing that cholesterol, lipid control is most important. And statins is the means the foremost drug which control the blood cholesterol level. If blood cholesterol not controlled with the statins medications, that's new recommendation is came out with like you can use the PCSK9 inhibitor or inclisiran is advisable to take care of these drugs. And along with the lifestyle modification is most important. Take the healthy diet and take the regular exercise is the most important thing, because if patient is heart attack and we have put the down the angioplasty, in that case patient sometimes LV dysfunction is there. So you should not advise the patient to do the more vigorous exercise immediately. There is increase gradual increment exercise is recommended. So depending upon the LV function, we are advising to go for the regular exercise and do aerobic exercise like jogging, initially with simple walking, and gradually increase with the cycling, swimming like that. And avoid that anaerobic activity like bodybuilding exercise. That is most important. You should avoid that a patient has a heart attack with the diabetic patient.
Doctor, you've given a lot of valuable tips. Finally, would you like to give some message to diabetic patients having heart issues or regarding heart health?
Yes, diabetes is a diabetes-related complications is total preventable. If that is controlled with these preventive measures, the diabetic patient can lead to the normal, long, and healthy active life as with the normal persons. And for that, most important is to take care of blood sugars immediately, and good control of blood sugar is most important. If there is other risk factors there like high lipid and high blood pressure and obesity, you should control that, and should not ignore the minor symptoms, because diabetic patient usually produce with the small minor symptoms like fatigability and dizziness, and should not ignore the mild symptoms. If there is any symptoms, go immediately for the regular checkup. And regular healthy means cardiac checkup is mandatory for that patient, because if you identify the problems or complications early before any symptoms occurs, so you can treat or prevent that complications early. So diabetes related complications is totally preventable. And if preventive can be take, the diabetic persons can live to the long, healthy, and normal life, active life as with the non-diabetic patients.
So my message to every diabetic patient is very simple. You have to power to protect your heart. Diabetes does increase the risk of heart disease, but right habits, regular checkups, timely treatment, you can live a long, healthy, active, and you must control your sugars, protect your heart regularly, meet your physician regularly. Don't ignore your symptoms like any mild chest discomfort, or when you feel breathless, dizzy, or uneven or uneasiness in your chest, you meet your nearest medical attention. Lifestyle is the powerful medicine. Healthy food, daily walking, stop smoking or alcohol, manage your stress, sleep on time, and take your medication regularly.
Dr. Devind, what message would you like to give to diabetic patients who have heart condition or regarding heart health in general?
So, if any patient who is having diabetes, first thing that in our Indian context, people think that if once the drug is started, it will be for lifelong. So, we should try to change the mentality of the persons that controlling the disease is more important as compared to the taking medications for the long time. Then our lifestyle is important. Try to do exercise regularly. Try to maintain the HbA1c between 6.5 to 7. In older age, it can be like between 7 to 7.5% is acceptable. We know that the chances of developing heart attack is approximately 2 to 4 times in higher in diabetic patients. So if any patient who is having diabetic, they should go for regular checkups, like along with the diabetic HbA1c, they should go for the lipid profile also. At regular interval, they should go for like treadmill test or CT angiography or some sort of screening test for heart disease also. And maintaining the blood sugar level strictly can reduce the chances of developing complications due to diabetes mellitus, because as we discussed, it can cause a stroke, it can cause diabetic retinopathy, it is important cause of blindness also. Heart attack, gastropathy means you can have diarrhea or loose motions, nephropathy. CKD is important cause. Chronic kidney disease is an important, diabetes is an important cause for chronic kidney disease. Then lower limb amputation, smoking, and diabetes.
Thank you so much, doctor, for your very valuable advice. And all the doctors have given a lot of suggestions and shared their wisdom and knowledge for the benefit and for increasing the awareness amongst diabetic patients so that they can manage their heart condition and prevent heart diseases from setting in. Also, lifestyle factor is one of the very critical things which can help in not only managing diabetes but also preventing heart issues regarding cardiovascular health. Thank you so much, all of you, for joining us on this webinar. It has been a pleasure talking to you. I'm sure our audiences would have had a lot of very important takeaways and tips regarding managing diabetes and preventing heart issues. Thank you for being with us.